Assalamu alaikum. I am Yumna Tafsir from 4th Prof Morning, and my topic is drug-induced thyroid disease. And the subtopic that I'm going to explain is iodide prophylaxis for radiation emergencies. Now, I would like to explain what is drug-induced thyroid disease. It is the disease in which thyroid secretions are inhibited and synthesis of thyroxine like T3, T4, TSH is also inhibited. These drugs are called anti-thyroid drugs and include drugs which cause thyrotoxicosis such as amiodarone and molecular targeted agents. Lithium and iodine are also found to inhibit internal secretion of thyroid hormone. They can cause hypothyroidism and mostly deteriorates patients having history of hypothyroidism. Now, I would like to explain what is prophylactic treatment. Prophylaxis or prophylactic treatment is a medication designed and used to prevent a disease from occurring. For example, antibiotics and vaccines also act as a prophylactic treatment. Now, thyroid absorbs available iodine from bloodstream. Thyroid gland cannot distinguish between regular and radioactive iodine, so it will absorb whatever it can, and therefore it is been stated that thyroid is the most radiation sensitive parts of body, radiation sensitive gland of body. In fact, these radiations are derived from nuclear explosions and released as radioactive rays. What is potassium iodide? It is basically a chemical compound. It also acts as medication, can be used as a medication, and can be used as a dietary supplement too. And as a dietary supplement, it is used by those people who have low intake of iodine in their diet. And the FDA approved brands of full adult dose is 130 milligram potassium iodide pills by the name of Ioset, Anabex, and Medpoint, and also Thyroblock. Now I'm here to discuss the case study of a woman, JM, who is a healthy 43-year-old Japanese woman who lives with her 2 young children 50 miles from a nuclear reactor damaged by an earthquake and tsunami. JM is concerned about the risks of radiation exposure and would like to protect herself and her children. What prophylaxis and benefits, if any, might be indicated for JM in case of a nuclear accident? Now here we have the subjective, objective assessment and plan, SOAP notes. And the subjective is a 43-year-old woman, obviously, with her 2 young children. So duration is basically the time since the nuclear explosion, till the time to the exposure to first radiation. That is the time when the radiation was first absorbed in the thyroid gland. Characterization may include that the patient is likely to have hypothyroidism because she is actually prone to radioactive iodine, and there are chances that she and her children may develop symptoms of hypothyroidism and thyroid toxicity. Alleviating factors include increased time of exposure to radiation, less evacuation facilities, and distance from the radiation source. We have observed no history of thyroid disease. Our objective is basically dependent on the lab test, which was not conducted, so no levels of hormones are determined, and as it provides prophylactic therapy, so we have not conducted the test, any laboratory test yet. For the assessment, we have to first calculate the dose, which should be proper according to age and susceptibility of thyroid disease, that which person is having higher risk of thyroid induced disease. So for the plan, we have to first conduct any test which is related to thyroid gland, such as for the hyperthyroidism, hypothyroidism in goiter. That is, we have to first check the levels of T4, TSH, and T3. And then we have to check for any disease history profile. We should check for dosage according to population and determine risk of repetitive dosing. That is, how much dose can be given, how much doses can be given repetitively. We should check if any toxicity occurs and provide proper management of iodine supplementation. Short-term administration of potassium iodide is safer in children than in adults. Now, these are some FDA guidelines about the dosing. FDA approves following doses of iodine in the form of potassium iodide in adults and children. We have 130 mg dose fixed for adult, and for children we have different populations such as school age children, which last for 60, which is 60 mg lasting approx 24 hours, and it should be continued until the risk of exposure is over. Adolescents close to 70 kg should take 130 mg full dose, and neonates should take 16 mg. Now, basis of prophylactic treatment should be based upon environmental contact of or environmental presence or content of radioactive iodine and time of exposure, and in how much time it reaches and gets absorbed into the thyroid gland. We will now look at the prophylactic plan in case of radiation emergency. Radiation emergencies are basically the panic situation, you can say, due to the nuclear explosion and the radioactive rays emitted from that explosion. So here, as the JM is exposed, is at the distance of 50 miles from the explosion, so we will discuss about the action that we should take for the distance from nuclear plant 0 to 50 miles. We should distribute the potassium iodide to every individual in the nearby domestic area, into every household, and extra stock should be kept for emergency situations. Now, benefits of prophylactic treatment and adverse effects of iodine therapy. Reduced risk benefits include reduced risk of developing thyroid cancer, as thyroid cancer and tumor formation are the most adverse effects which occurs due to exposure to radiation emergency. In the case of radiation emergency, and in the case of exposure to radioactive iodine, thyroid cancer, that is formation of tumor cells, is the most common and most harmful effect. Now we will check for the it actually prevents hypothyroidism, hyperthyroidism, and a disease which is called goiter, in which there is a deficiency of regular iodine and swelling in the thyroid gland. Now, what are the adverse effects of this iodine therapy? Overdosing obviously should be avoided, but in sensitive patients, minor doses can also cause these adverse effects. That is, cellulitis, GI disturbances, rash, allergic reactions, especially associated with the people having dermatitis, and toxicity occurs due to overdose. That is when we do not give proper doses, and when repetitive doses are followed, so thyroid toxicity may occur. Thank you.